Infertility, according to the consultant obstetric and gynecology, Dr. Abdullah Muhammad Kabir, is the inability of a couple to achieve pregnancy after staying together for a year. It is now a public health problem that has continued to affect families. Dr. Abdullah Kabir said out of every 10 women who visit the gynae clinics, 5 come with the problem of infertility. He noted that this problem cuts across all age groups. The medical practitioner said infertility is not a woman's issue only, noting that 30% of the problem is from the woman, 30% from the man, and another 30% is from both, while 10% is unexplained causes. The question then is what causes infertility, either in the woman or the man. The consultant, in response to this, said there are 3 major causes that include the ovulation of the woman, blocked fallopian tubes, which is as a result of pelvic inflammatory disease, and low sperm count in the male.
So that you produce sperm does not mean you always have sperm cells. So this we should know, because sometimes some men, they will tell you that they have no problem having intercourse with their wives and they produce sperm enough. They don't know that sometimes some of those sperms are not even there inside the semen, or the count is very low. Or sometimes it may be that there are sperm cells in adequate number, but they don't move. The sperm cells need to move from the vagina to the tubes where I mentioned fertilization occur.
Dr. Abdullah Kabir said the good news is that there are treatment options for infertility and is usually directed at the particular cause.
Are pregnant. The good thing about the management of infertility is that there is treatment. What actually limits what you do is the availability of actually the instruments and personnel that have experience to manage the problem. Just that sometimes it's expensive because of lack of the availability of some of the higher treatment.
He stated that infertility also affects couples who have once delivered before and advised women to avoid multiple sexual partners, change their lifestyle, what they eat, and treat pelvic inflammatory infection properly.
So my advice now to men and women, or generally to the society, is that infertility is real. It affects a lot of couples. It doesn't respect age, whether you are young or old. It can be a problem, and that you have delivered before does not mean you could not have it. So some of the things that I will advise is, like, for females, anything that will put a woman at risk of sexually transmitted infection is a problem.
Elizabeth Carr, BATV News.